Okay, good afternoon, everybody. Thank you for this coming, to the committee members for coming quickly and for this quick notice. Golly, is it loud? Okay, let's see if that does. It seemed to have an echo. Okay, and we have Senate Bill 375 from one of our senators, Senator Strickland, and we're going to go with that one first. So, Senator Strickland, wherever you want to be,
I'll just
sir.
stand here. Hopefully I'm kind of quick. Thank you, Madam Chair, members of the committee. I bring you Senate Bill 375. It's hopefully an easy one for you. It just adds a Commissioner of Veterans Service to our Behavioral Health Coordinating Council. It was something that in the Senate we looked at and looking at all of our efforts, and especially the efforts that the House has led on mental health reform. We want to make sure that the Commissioner of Veterans Service is also at the table when it comes to our agencies coming together, trying to figure out how best to serve people in our state when looking at behavioral health issues. So that's the bill, and I'm happy to take any questions.
Questions for the senator? We don't have any questions? Okay, is there anyone in the audience that wants to speak on Senate Bill 375? Okay, seeing none, it was going to be a quick
It
bill.
won't all be this easy, Madam Chair. So
I need a motion. And a second. Okay, any other further discussion? Anybody come up with a question? Okay. Oh, the House sponsor.
that's a good. I just realized you're probably going to ask me that. I have not asked anybody to carry it. So if anybody's open to carrying it on the committee or no, I'll let.
Okay.
That's true.
Okay.
I trust all y'all. So
Representative Mashburn, my vice chair, is willing to
thank you.
carry
Appreciate it,
it for
Representative.
you. So we'll get that done and, do whatever I need to fill out for you to get it moving. You'll be sure and do that, or
I'll go fill the form out.
run me down. Okay, so we have a motion and a second. Everyone in favor of the passage of Senate Bill 375, say aye. Aye. Anyone opposed, no? Okay, the ayes
Thank you.
have it.
See y'all again
Thank
soon.
you very much.
Thank you.
Okay, let's see. Okay, let's see if this one's going to be easy. Okay, Representative Lott. Is Representative Leverett here yet? No, is he here? Okay, well, all right, we've got one before him. Okay, you have the floor, Representative Lott.
Thank you, Madam Chair. I think that this will be an easy one as well. I am here for House Bill 1408. It is LC 339662. And this legislation adds ulcerative colitis to the THC oil patient registry. We did pass this bill. It was House Bill 117, sponsored by Representative Walensky in the 2021-22 session. It passed the House Chamber 170-2. So this is the exact same. We're just adding ulcerative colitis, which is an inflammatory bowel disease, similar to Crohn's, which is already on the list.
Anything else?
Nothing
For
else.
the committee to know. Okay.
And I have assured the chairwoman that we are not adding anything, including legislators, to the list.
Goes forward. Okay, questions? No one has a question? Oh, go ahead.
Thank you, Madam Chair. I'm just curious how ulcerative colitis got here over other diagnoses. Like what made this one stand out?
I think because other states have this on as well, and Crohn's disease is already there, so it's very similar for the GI physicians to be able to utilize this registry.
Okay.
Okay, we've got, hey Claire, nice to have you back. If we're just adding this to the list, why do we have to go with all of this other mental health area? Why wouldn't we just add it, I'm just curious about going further. Just add it to the list of illnesses covered.
You mean instead of having them enumerated the way that they are?
Yes?
We could do that.
I mean, or going in through the same thing if it's open. This seems to, where did you get this language, Representative Lott? It seems to be more I mean, because we were,
I'm not sure what you're referring to. When they just repeated the
minute.
list?
never mind.
Okay.
Okay.
So
I have the wrong bill.
okay. So all we have done truly is line 32, added ulcerative colitis to the bottom of the current
Right.
list of,
Okay, my fault,
That's
sorry.
fine.
Okay. We have, anybody else come up with a question or anything? I'm moving too fast. All right, I need a motion. Got a motion, do I have a second? Okay, any other discussion? Does anybody from the audience that wants to talk about this bill? Okay, seeing no one. Okay, everyone in favor of the passage of Senate Bill,
House bill,
House
please.
Bill, don't mind me, 1408, say aye. Anyone opposed, say no. We had a no? That wasn't me. Okay. Okay. Oh, only one, okay. So I don't have to take a hand vote for it? Okay. So we have one no vote, so House Bill 1408 has passed.
Thank you.
Thank
Madam
you.
Chair.
I've got to quit running between buildings. And it sort of does something by my mental ability. Okay, and here's the bill. I said from the well, I thought you would find interesting. Okay, Representative Leverett, you're up for House Bill 1409.
Thank you, Madam Chairman. I'm here to present House Bill 1409. This is a bill that would try to encourage the provision of mental health services to citizens of our state, and especially with respect to persons who are receiving indigent care. We filed the bill and have had a request for some changes. I believe the chair lady got a text concerning that, and so we anticipate making some changes. We have reached agreement on some additional terms, but just haven't had a chance to get the bill drafted. Our ask is that we get this bill moved out so we can at least continue and make some revisions before we get to the floor. The changes generally involve, if you'll look on,
Well, why don't you tell us what the bill involves first? Let's go over that, and then you can tell us what the proposed changes will be.
all right, so the bill has a number of definitions on page 2. There is I guess, point section 1, that will not change, and that just notes that there is a crisis with regard to provision of mental health care services in the state. And this is, the purpose of the bill is try to increase the numerosity of care that's available and the breadth of care that's available.
Is it
Excuse me?
mainly to increase the number of beds for inpatient care, or mainly for outpatient?
I think it's primarily for inpatient care, and I'm seeing some heads nodding, so I've got that right. And so a number of the definitions on page 2 would change because, as currently drafted, the bill is a bit broader than I think we want it to be, and so we're going to try to narrow the scope of the protection. The main vehicle by which we sort of try to encourage the industry is we do somewhat like we've done with ER care, where we have changed the standard from mere negligence to gross negligence. But we're trying to limit the degree to which that applies. It would not apply to third-party claims. It would only apply to inpatient care claims by one patient involving either the care they received or something that happened from another patient at the time. And so we're trying to sort of narrow that scope a bit. There is also, if you look on page 3 in lines 59 through 62, that's the sort of the meat of the bill, where it goes to a gross negligence standard, but currently as drafted, it also increases the burden of proof from preponderance of the evidence to clear and convincing evidence, and that is going to be reduced back to the preponderance of the evidence. So we're not changing the burden of proof as well as changing the standard of care. We're just changing the standard. And then you'll notice there's also some language in there on jury instructions. And then we provide an effective date that it applies to causes of action that accrue after July 1 of 2024. So we're not trying to do this retrospectively. So that is the sort of the gist of the bill and the changes that are contemplated. I'm not sure if I covered all of them. Mr. Bozeman may need to correct me if I left something out.
Well, okay, I think you're used to going to judiciary with a bunch of lawyers. And we're not used to lawyer bills. And so what I really would like for the committee to know, since this is a rush thing and I want the committee to know what they're voting on. First of all, why do we have this bill? And why do we need this bill? I mean, we don't normally have special rules for immunity for like med-surg floors I know we do from the emergency room. That was left over from the first time we redid some tort reform way back, and I think it was on that committee in 2007 or something. And the one about OB is left over from that one. And so why all of a sudden are we having where a specific type of illness is going to need immunity? And explain what kind. I just would like for a explanation that gives us reasons for this.
Yes, Madam Chair. I'm John Bozeman with Frederick Bozeman Public Affairs. I represent UHS Hospitals. Got with me Sally Perry and Corey Jackson. Sally.
Do I need to get the other people to scoot over so you're not leaning like that to talk into the mic?
So I have been working on this matter from the beginning of the session, so this is not, and we have been negotiating an outcome here with the Georgia Trial Bar at the behest of quite frankly, the speaker. I really appreciate him recognizing the purpose that we need a bill here, and the bill is to open up mental health beds. They represent a number of hospitals here in Georgia, all private psych hospitals that have essentially become part of Georgia's safety net. And the liable exposure for individuals that are coming to their hospitals are essentially people that are showing up that are in danger to themselves or others, meaning they're going to either hurt themselves or they're going to hurt somebody else. The simple bottom line of this bill is the state of Georgia has decided in its policy and its wisdom that they are going to give protections for emergency rooms and for OBs, because emergency rooms are dealing with people in crisis, just like anyone who shows up to our hospitals and has to be cared for when they walk in the front door. We have 3 levels of care that we're attempting to seek a higher standard of protection for, and that would be acute hospitals, psych hospitals, long-term residential hospitals, and therapeutic foster care. The therapeutic foster care is a program, and the program is intended to have an offering to the state that is a alternative to hoteling. I got a call from Sally over the summer that they were looking to stop that program because of litigation risks were too high. And so this is a path that we started going down. I see the Georgia Hospital Association is in the room as well. There's another component of this that is not in this bill. Sally, who sits on their board, has essentially said we are good with waiving our protections for CON because we believe there needs to be more beds for psych in Georgia and for medical hospitals as well. So it's our hope to also include any medical wing that wants to have psych beds as well. So the intention of this whole bill is to make a greater availability for psych beds and to relieve and create an environment that is much stronger for folks that want to care for these folks, knowing that they're walking liabilities when they walk into these programs.
Okay, let me and Rob, if you want to sit down on the, sit down for a minute.
Okay, thank you, Madam
Okay,
Chair.
all right. So what you're saying, and I didn't realize, okay, your client represents lots of mental health facilities that take patients in-house, basically, right? Right. So if somebody has a son or daughter that's having a crisis intervention, they can show up at the door of one of your places, and it's my understanding you're saying that you have to take them.
Absolutely.
Whether they have insurance, whether they don't, you have to take them if they're in crisis.
Correct.
Okay, and so I didn't realize that. I knew we had to do it for hospitals, but I didn't realize that these smaller psychiatric hospitals had to do it. And what you're saying is, okay, because you have to do that, and because you're saying that psychiatric patients, even if they don't go in the emergency situation, present the type of behaviors that become more problematic, leading to perhaps situations where they might hurt somebody, or they may be hurt, or they may leave or do harm to themselves, that because of that higher acuity, that there should be this immunity like it is for emergency rooms and for OBs. Is that it? Sort of
Yes,
in a
ma'am.
nutshell?
In a nutshell, that is it. Correct.
Okay. Questions from the committee? Okay, who we got? Representative Al.
Good afternoon. Thank you for presenting this bill. Isn't it true that this bill is synchronous with something we've seen today that seems to emphasize increasing access to and decreasing barriers to accessing necessary psychiatric care in this state, similar to HB 1339, which we just passed unanimously out of the House this afternoon?
What did 1339 do? We passed a bunch of bills. I don't remember.
Butch Parrish's bill, the CON.
Oh, you're right.
Oh, sorry, the CON.
So yes, ma'am, I would say not only is this in sync, but that's part of what the hospitals have, they were part of that conversation, and if you look at the only part of CON that was totally waived, it was for psych hospitals, because we want to see small community hospitals put wings of psychiatric beds to care for patients all over the state of Georgia. We're the only ones in there that have a complete repeal. And it's because this whole effort is to say we have a bed shortage for psychiatric patients, and we need to open up the access. Thank you for the question.
Okay. Representative Lott. I just want us to be clear. I'm not challenging the premise for the bill, but I'm just trying to make sure everybody knows what we're doing here. Representative Lott.
I understand that, thank you, Madam Chair. I do understand that there are some changes you want to make to this. Is that anything that you want to share at this time so we know what we're missing?
Yeah, I think it's on, can Rob do it, or when we get to it?
John can probably help.
Okay.
I'm happy to answer. I mean, it's simply two changes. One is we've actually lightened our protections. Remember that all this does is allow us some protections so that you have to use gross negligence. It's the standard, not
Okay, so the
negligence.
way it's written now, pretty much everything is pretty much waived. It's such a high bar before you could be sued.
No, it's a low bar. Right now, there's no bar. We can sue us for anything. All right? What we're saying
Okay,
is
there's a low bar, you
yeah,
couldn't be sued
right.
for anything you did.
we're taking on highly litigious patients that are there to hurt or kill themselves or hurt others. All right, when they walk
Okay.
in, we may not have any case information on them. We may not know anything about them. They walk into our front door as emergency receiving facilities. We have to treat everybody that shows up. All we're saying is give us some relief on negligence, have a little higher standard of proof of gross negligence, because everyone that we walk, everyone's volatile in these settings, and we just want some relief so we can continue to serve and open the beds.
Okay, that's the one thing, okay, and what this first bill did, Rob, what they call, what level, what do they call this, where they were pretty open, they wouldn't be sued by anything?
You mean the draft you've got before you?
Yes.
Well, you would be subject, without this bill, they would be subject to a negligence standard, which is a lot easier to show than a gross negligence standard. So this is giving them some additional protection where they would not be subject to liability in as many cases as it
Okay.
without them.
But the agreement that's come, what does it move that to? How does it
The
change
agreement
it?
only changes two things in this bill.
Okay,
Number one, when it comes to gross negligence, you have clear and convincing standard that moves to preponderance of evidence, which is a lower standard, right? So the lawyers have an easier time suing a preponderance of evidence. So the other thing it does is allows when any patient leaves the hospital, you can sue. If we discharge too early, whatever the case is, they are not under protection unless they're being served in our facility.
okay. Rob, please tell me and explain to me, I guess I'm not slow.
No,
And
ma'am,
I've
I think
gotten my-
I
I've
think I-
gotten my oxygen level back.
I think I
This-
confused the issue, Madam Chairman. There are two components. One is the standard of care negligence versus gross negligence. The other issue that the bill impacted was the standard of proof, what you have to prove in a court.
Okay,
The bill before.
wait, okay, the bill before us did what? Which, on
The
both of
bill
those?
before you requires that a claimant show by clear and convincing evidence the gross negligence, which is extremely difficult to reach. That's higher than, you can be convicted of a crime for less than clear and convincing evidence. That's
Okay.
the highest standard of proof that there is. The agreement, and that would be changed, would go back to what you generally prove in a civil court anywhere, which is preponderance of the evidence.
Okay,
The gross negligence does not change. The clear and convincing evidence is changing. And in the substitute we're getting drafted.
okay, that's what I was trying to get the technical word to that. Okay, Representative Hutchinson.
Thank you, Madam Chair. I just want to thank you for this bill as a mental health provider. I've heard a lot about this bill and how it was comparing mental health providers to doctors. And that this would give mental health providers the same level of accountability as doctors. The thing I want to point out is a doctor's average salary in Georgia is approximately, according to Google, $170,000. The average salary for a mental health professional in Georgia is $66,000. So when we're talking about money and how much liability insurance costs these days, this is a huge, huge help for mental health providers. And if there's nothing that I say at this Capitol, I want everyone to understand that Georgia has a adversarial relationship with mental health providers. They make you question choosing this as a life choice every single day. I probably should have had a business where I made something and I can see what I've made at the end of the day, but in mental health, you can't do that. It's all registered with how you feel. If you feel better, if you don't feel better, there's no blood test we can take. So giving us a little bit of leeway really, I think, helps in making this a less adversarial relationship with mental health providers. So I'm in support of the bill. Thank you.
Okay, but this would only cover people working in these hospitals,
Yes. It
right?
needs to go further, for sure.
Pardon?
It needs to go further.
Oh,
It should go further. It
Okay,
should go further than just
right
hospitals,
now,
but
this bill
I'm
only
grateful.
covers people working in these hospitals.
It also covers, in this version, it covers protection for those involved in a therapeutic foster care program,
Right. Okay,
which is the alternative to hoteling.
right. Okay, Representative Reese.
Thank you, Madam Chair. I guess I have a few questions. Can you talk to us about the current volume of lawsuits and how we were able to conclude that it's because of legal actions that we are seeing these facilities impacted in a way? Where's the evidence of this?
I'm not the attorney for the hospital system, but maybe they can respond to. Yes, Sally, if you would.
I don't know the exact volume, but it's not necessarily a volume issue as it is the staggering award amounts. You can have one claim that can take out your ability to operate.
Now, from a, I guess, unconscionable claim perspective in which you are stating here, there are awards that are appealed quite often, and quite often our higher courts lower what some people consider to be some ridiculous awards at some times. I guess my concern, the little concern, I do appreciate the changes, Mr. Chairman, that you presented earlier for this bill, Chairman Leverett, moving it to taking out outpatient and certainly getting rid of clear and convincing evidence. That's standard. I mean, that's just unbelievable. That's a hard bar to reach. I still have a little concern about the people that are there. And I just want to know how are we balancing this on your end to make sure, even though we're making this harder for people to sue, and it's easy to beat up on the lawyers. You know, I'm a lawyer. We get beat up on quite often. I understand that. But what are we doing to balance this with the care of the individuals that are there receiving the services? And looking at the bill, I understand that they come in sometimes with lack of information that if you could provide outstanding care. I understand that. A lot of times you're feeling around in the dark, if you will, trying to figure out how do I work with this individual. But that person still deserves some form of protection. So just assure me that we're going to give them the highest level of care, even though we are lowering the ability for that individual to seek some type of remedy if they are hurt in a situation. Even though we're doing that, I need to be assured that those individuals are still receiving care that we would consider to be suitable for folks.
The intent of this bill is to help our state grow in the availability we have to treat others. When it comes to assuring you that the patients are still going to give quality care, I think that's a fair ask and something that should be asked. Our providers, our doctors, our therapists, our nurses are not affected by this bill. They don't know the difference between negligence and gross negligence. They show up every day providing the best care possible for our patients. I don't want to get off.
And I guess that's why I'm in a catch-22, because my wife is a family medicine physician. I understand that, a lawyer and a doctor. So, we're constantly, but we also are able to reach good ground sometimes when we're having conversations about how we move forward in this matter. And just to be clear, I want you to be able to do your job because we need these type services. Let's be absolutely clear. But I don't want us to get to a point to where we're trading growth for intolerable treatment either. I don't want the pendulum to swing so far that we say, yeah, we grew the state by 1,000 new beds, but those people in those facilities are treated miserably. That would be unacceptable. That's not Georgia. Mm-hmm. We are better than that. So, Madam Chair, I just want us to get to a place. I'm not totally against this at all, and I want to be clear on that. I just want to get to a place to where we are still concerned about patient care, and it's not just about growth. Making sure we're still maintaining the standard of care that the patients deserve and that they need. And the checks and balance, that's usually where this comes in. And
Okay, Anna? Okay, we're a little different than judiciary. So, Anna, are this type of hospitals under the same oversight and same inspection things as the other hospitals,
Yeah.
a regular med-surg
Yes,
hospital
ma'am.
and all?
Yes, ma'am.
And complaints would be, and you would have oversights and ability to bring sanctions against them and so forth, just like any other hospital in our state?
I would argue that they also have a second layer of oversight because they have both the Department of Behavioral Health and Developmental Disabilities and the Department of Community Health. So really they have two bosses.
And to answer to both the bosses.
Yes.
Does that help, Teddy?
yeah, it helped. And let me just be clear, that helped a lot. Thank you so much. And I trust that our professionals here with the state will continue to do their great job at making sure that we're taking care of the citizens of this state. Measures like this changes the standard of proof once you're in a lawsuit. It may not stop the lawsuit. People can still sue you. You're still going to have to deal with that volume. You're still going to have to deal with the attorney fees and things of that nature. You're more concerned about I think you stated, ma'am, that you're more concerned about the high awards that are being given out, in which I'm not sure if this even begins to address that at all. It talks about, Chairman, it talks about standards and proof, but it is not touching what a jury may still give a family or an individual in the midst of a lawsuit. So I think that's probably the conversations we need to be having, but
Well, I'm thinking part of this too is that our mental health care providers, it's a parity issue as well. We should have the same protections as the EDs and the OBs. We take in patients who are in active crisis. We don't know their history. We don't know their social histories, their legal histories. If they have any medical comorbidities, we assume that risk to ensure the safety of our community. And so we are asking not protections from gross negligence. We still hold ourselves to providing a great level of care, but we need some protections given we are taking on a significant risk.
What I was trying to draw out from everybody trying to pass this bill, I think I'm probably, maybe the only one except Representative Al, who may have passed through the psych unit in her education. I actually worked a psych unit, wrote a couple of books that are related to nursing and psychiatric nursing. Psych patients that need to be hospitalized and end up staying in hospitals are sometimes the most combative, hard to handle, to calm down. If they're on drugs, in the emergency room, had somebody come in on drugs. And if you have ever been in an emergency room that has some beds that will move, they are very, very heavy. And I saw somebody on drugs take one of them and move it like it was a toy bed. I also had a concussion for being in the way when a fight broke out on the unit, and was trying to get off the unit as a student nurse and didn't make it to the door in time. It's their illnesses, and as they hallucinate or they're in a high stage of excitement, you can have trouble. And I think that this is in taking these patients, and one of the things with our children that you're talking about the program with DFACS and the program, are they not the ones that, like when we were doing hoteling, that ended up that they were too disturbed for any of the parents that would take foster children to take them because they were uncontrollable?
Yes, absolutely. My hospital in particular, during that time frame, and we don't see it as much, right? Which is a good job for everyone in the state to be able to help find these kids a place to be. However, I have two different sides of my hospital. I have an acute care, which is a short-term stay, average for about 7 to 10 days, right? You come in for stabilization, have crisis in the community. Our goal is to get the child stable, back into the community, healthy with wraparound services. 7 to 10 days, keep in mind, right? We'll have long-term care, average 4 to 6 months at the most, right? During this time frame, we've had youth who were abandoned, so to speak, right, by parents.
Can't handle them.
Can't handle them. The state did not want them into custody, right? Would not allow them to come into custody. And guess what? They're with us. From acute care stay from 7 to 10 days, ended up being 30 days, 45 days, 50 days, right? They have nowhere to go. We are there, and we're still providing the psychiatric treatment that they need. And also, when they're ready to be stabilized and come back to the community, we're also providing a place for them to rest, right? Which is ideally not where you want a stable kid to be, is in a hospital setting, right? A part of this helps us in our foster care opportunity as we're looking to expand to get the kid back into the community, the ability for us to expand, understanding that there will be liability, right? But if we have an incident that may happen and we're not grossly negligent, we don't have to worry about all of those services pulling back and saying we can't continue these services anymore. This gives us the ability to do more in the community with the youth rather than worrying about if I have a kid that has something that happened that we did not know the knowledge of, or if something happened where we make a mistake but it wasn't grossly negligent because we're not perfect. We don't have to worry about us shutting the whole venue down and take away those beds that we are trying to, number one, maintain and also expand on.
Okay. Representative Al?
I just want to address this concern that Representative Reese has about decreasing the quality of care as a result of this bill. We're going to kiss and make up later. It's going to be fine. Doctors and lawyers don't always get along. One thing I want to note is clinicians don't give worse care because they're less worried about being sued, right? Because there's ethical and professional standards that underlie everything we do that exists irrespective of the legal environment, right? What I think sometimes we fail to take into account is that like a hostile legal environment, like we sometimes see in Georgia when it comes to medical malpractice, is that that environment actually can sometimes lead to lower quality care, because when people practice defensive medicine in a way that is designed to avoid a lawsuit, it's oftentimes worse care for patients, because it means ordering more tests that are unnecessary, not taking care of them according to clinical standards rather than defensive standards, and worrying about the lawsuit rather than worrying about the patient. So that's just something I want to bring up, that there's a converse to that argument. I love you, Teddy. You're great. But
And it's true. I mean, she's right. And, you know, and I'm not being disparaging about mental health patients. They are ill just like a patient if they had cancer. It's just exhibited in different ways, and it's often exhibited in very physical ways and in ways that are not always easy to handle. And for many staffing members, we don't have as many psychiatric nurse practitioners as we have other nurse practitioners. You know, we need more, and it's a hard field, and the people work in it, it is a hard field. Representative Perkle.
Thank you, Madam Chair. I would pay money to be there when Representative Reese goes to his physician wife and says that he stuck up for the lawyers in this hearing. That would be absolutely, that would be wonderful. And I understand. I actually like the bill, I think, as it is written. I was not aware that we had to negotiate with lawyers to free up psych beds. I want to see, honestly, because this is a segment that is prone to self-harm. So it'd be like if I'm an insurer that insured a lawn dart league, and the lawyers are knocking at the door because I am doing a lawn dart league. But assume that we could not get rid of the lawn darts, that this is something that happens. Like people with mental illness, we have to address where they are. And I'm not in favor of lowering the bar. I am opposed to lowering the bar for a population that desperately needs beds. The state of Georgia desperately needs more psych beds. And if we're going to lower the bar because of our lawyer friends, what in our negotiation, are we going to lose additional beds that we would have otherwise had? That was the question I had.
You want me to try to take that? Thank you for the question. And I would say that this is, I'm honored to be part of this conversation. A lot of my friends know that my daughter's had mental health care issues, and I've seen this from firsthand. We've invested everything in her life to make sure she's okay. She's got the resources to be okay. Many people don't. So when you talk about patient care, doctor, you're right. People aren't looking at whether they're negligent or not negligent when they're making healthcare decisions. They're trying to take care of the patients. I saw that firsthand with my daughter, firsthand. So I want to thank everyone. I want to thank the speaker. This is here because Speaker Burns cares about people. I believe that strongly, and he wants to open up beds. And yes, Representative Perkle, this doesn't go far enough in my opinion. But I want to thank Dan Sipes and I want to thank Jordan Reed, who spent hours and hours and hours and hours and hours trying to find something that we could all agree upon. And this doesn't give us everything we want. Certainly doesn't give them what they want. But I'm a man that wants to see something good happen this session, and I think we're there.
I think it's called The Art of Compromise, and trying to find a compromise that is good for patients, not in how they're dealt with, but also protects them if, like Representative Reese says, something goes wrong. Representative Howard.
Yeah, thank you for the bill. It's much needed. As we all know, beds are needed in Georgia. I have a simple question, and maybe I've been trying to Google it, but I couldn't get a good answer. Who decides the difference between negligence and gross negligence? Is there a clearly defined line there? Okay, let the lawyer do it.
That is the enlightened conscience of the jury, Representative Howard. It's generally a jury question. So those are fairly well-established legal terms that leave some range for applying them to individual circumstances, and it's sort of reasonably what would a reasonable professional have done in similar circumstances. But the jury makes that decision, subject to any expert testimony that gets introduced in a trial of medical malpractice. It's a long answer, Madam Chairman, but that is unfortunately the answer.
Representative Lott, we're back to you.
Thank you, Madam Chair. I do want to say as well, I didn't kind of finish that thought earlier, but I appreciate you bringing this legislation for sure. And I agree with that this will help grow some beds in Georgia. I do actually, and this may be a legal question, but I do have a question on line 70 and 71, and this is just because I'm not a lawyer. But could you explain to me number 3 and number 4, the difference between provision and delivery? How those two lines are different or mean something different?
Madam Chair, can I give a shot at that? May I take a shot at that, Madam? So I believe they can be somewhat synonymous, obviously, but I think provision may refer to the specific manner in which the care was provided to that patient at that particular time, whereas delivery has sort of a broader use.
You got me. Okay, then.
I mean, the short answer is I didn't draft that, but I'm assuming those terms have use within the jurisprudence. I don't know the exact definition for them, but I think there's some slight nuances in their meaning and how they would be applied in a particular circumstance. So this is just a jury instruction. I think is intended to sort of acknowledge the challenges that these providers face.
Thank you.
Well, we got a couple other lawyers in the room. Anybody want to try to be more specific about that? Okay, all right. So, Representative Dempsey.
Thank you, Madam Chairman. No, I just wanted to say that I really think we have to really all try to remember that this is for youth. This is for individuals under 21, and that is where we have our greatest shortfall, not only of services, but certainly of beds and of providers. So let's keep thinking about that as well as we go through this process. We're not talking about adults. We're not talking about your local hospital. We're talking about very specialized care and service that we do not have enough of.
Calls and phone calls of parents at their wits' end saying, if I just had somewhere, my child needs to be in-house for longer than 3 days when, they get evaluated and they're back out again. And there's no place for them to go, especially the ones who can't afford it. And this does include but also even for the ones that have all the money in the world cannot find a place where their child can get care. Unfortunately, the other thing is mental illnesses very often don't take care of themselves and get cleared up in 3 days or 5 days, like in hospitals, for an appendectomy and you're in and you're out. They can often take weeks or months before with care that they need. Representative Reese.
Madam Chair, thank you for calling on me again. I know you didn't have to, but for the sake of my marriage, I need to clear some things up because Perco has put some things in the air that shouldn't be out there. But let me be clear. I think I said it 3 times in my comments. I'm going to make it 4 for my friend back here. I am not against this bill. This bill is not for lawyers. This bill is for the people. Lawyers work for the people. Just like truck drivers deliver things they don't know what's in the trailer, we try to deliver legal services for people that call us. I know it's easy to beat up on us. I accept that. That's fine. That's fine. We'll be the punching bag in this room. But I have to balance that, too, with my concern for health services, especially for our youth in this state, as Representative Dempsey said, and that is a challenge. And we do have to talk about how we do these things. But when we get to the point to where we can't discuss it, then, we're at a challenging point as a state. And so I like to compromise, as I told Mr. Chairman Leverett. I do like the compromises with the things that he said we're going to change here, and I think we can work with that. To Representative Howard, you asked about negligence and gross negligence. As Representative Chairman Leverett said, that's to be determined by the jury. But negligence itself is just 4 basic principles. You have a duty, you breach that duty, there's causation, and you can show damages. When you're moving the standard higher to gross negligence, you have to show greater evidence as it relates to that breach. What did the person do wrong? And considering the circumstances, I can see why we would possibly want to move that to a higher level, considering what they have to deal with when the people come in, the lack of information that they do have. Now, if they had all this information, I would be extremely opposed against moving this, because someone who knows better should do better. But out of sight, out of mind, when you're trying to provide services. And I just need everybody in the room to know that I know that our medical health professions, they work extremely hard for us here in this state, and they do a wonderful job. And I have the honor of laying down with one every night, my honey bunch, and I appreciate her so much. And we're gonna go back and watch this video, and I want her to know I'm supporting her profession. You see what you did, man?
Thank you. Okay, and our legal counsel, Claire, said she looked it up, and there is no difference between provision and delivery. She was not the one who did this. So, and well, okay, I think we've got a couple more questions. Representative Hutchinson.
Thank you, Madam Chair. I just would like to put Representative Reese's mind at ease. I'm not a hospital, and I'm not a foster care provider, so this would not cover me at all. But to be a mental health provider in Georgia, first you have to apply to Department of DBHDD. That level is high. That bar is really high. It is required that me, a very small mental health provider, has to give the same certification as any hospital. JCO, CARF, I have to do that, even though I'm not a hospital. It's very expensive, and it's very detail-oriented. Push that aside, every contract that we have, DBHDD, every insurance company, all of the CMOs, Medicaid, all of them all audit every month. It's really fresh for me right now. We had an audit last summer, and it was one of the CMOs. They said that their biggest criticism was that our sessions started too exact. In other words, we started at 2 o'clock versus 2:03. 2 o'clock versus, we had like 2 o'clock to 2:40. They said that it was highly unusual that we started every session exactly on the hour. All right, I can take that, criticism. Last week we got a $22,000 bill because they recouped every claim we did that started on the hour. I am not worried about being sued. I'm more worried about audits and people who won't send me a referral if I fail an audit, if I don't do well on an audit, which is every month. That's what I'm more worried about, because if I have no referrals, there's no need for lawsuits. But I cannot expand. I will not grow, because that's a lot. That's a lot to hold on to, particularly if you're housing kids now. There's no way. Most providers feel that way. That's why we don't have beds. It's not worth it. It's a loss. It's a loss anytime a provider even tries this. So I'm not worried about quality of care at all in Georgia. I'm more worried about keeping businesses open and having those beds and that exposure and those resources expand. And I don't think we have a problem with that in Georgia at all. This is a drop in the bucket of a whole movement that needs to happen. If we really are committed to offering mental health to everyone in Georgia, if we have these restrictive, punitive relationship with the state of Georgia, it will always be this bad. So again, thank you. And I'm not worried about the level of care in Georgia at all, because we have more people that are hired to do audits than we do service provision. And that needs to change. So thank you.
And you're saying that these providers are going to face the same thing. You're in an independent provider, but that you will face the same kind of thing.
It's the same auditing. It's the same thing.
Okay. Sounds like, I mean, this is a start. There are other things to explore. Not to take away their ability to audit, but to be picky is maybe what we really look at, if that's the problem. Representative Perkle.
It's just at the proper moment, I'd like to make a motion.
Representative Seaball, we haven't heard from you.
Thank you, Madam Chair. My question, Chairman Leverett, do we need to make an amendment to what we have in front of us?
You mean about the changes? No, we got the word that that agreement was reached so late, there will be a rules substitute in the morning.
Okay, very
But
good.
one of the reasons I wanted them to explain to you was so that the committee knew what was coming and knew how it would change in rules, because most of you are not on rules, but so that you would know what was going to be changed is why.
Okay, I just want to make sure,
This exercise.
I just want to make sure we didn't have to make an amendment before we pass
Okay,
this.
I think that gets everybody, right, you got another? Okay, and so we have a motion, do we have a second? Okay, we have a motion and a second on your bill. Is there anybody from the audience that wants to speak to the bill? Yay or nay against it, whichever way. Okay, hearing none, then we have House Bill 1409. We have a motion to pass and a second. Everyone in the favor of passage of House Bill 1409, say aye. Aye. And everyone's opposed, say no. So the ayes have it. Thank you for tolerating us and explaining things to us. Thank
Not
you.
at all, Madam Chairman.
And we look forward to seeing this move on. Do you have the ones in